spotting between periods, heavy flow, and period pain. There are a few gynecologic conditions that can cause these symptoms. What makes things even more difficult is that many of these conditions can coexist. In today's episode, I'm covering one of these conditions that affects somewhere around 20 to 35% of menstruators. It's a little bit of a difficult one to pronounce. Kind of sounds like endometriosis, and actually it hangs out quite often with endo, but it is different from endo. We're talking about adenomyosis. I'm naturopathic Dr. Ann Hussain, and this is Phase to Phase, the Hormone Health Show. If you've never heard of adenomyosis, you're not alone. Part of this reason is that isolated adenomyosis, meaning that you only have adenomyosis and nothing else, only happens in around 10% of cases. More often than not, we're finding it alongside other conditions like fibroids in 50% of cases, endometriosis in 11% of cases, and polyps in 7%. Plus, adenomyosis can be fairly asymptomatic in 30% of cases, so those people might not experience any significant symptoms at all. Before we get into what adenomyosis means for you, your fertility, and your treatment options, let's start with a quick intro to what it is. So if you think of your uterus, there are 3 layers. The outermost layer is the perimetrium. The middle layer is this muscular layer called the myometrium, and the inside layer, the one that lines the cavity of your uterus, that is your endometrium. Usually, when we're talking about periods, we talk the most about this innermost lining, the endometrium, and we are going to talk about it today, but we're more interested in this middle muscular layer of the uterus called the myometrium when we talk about adenomyosis. So what is adenomyosis? Simply put, it's when tissue on that inside of your uterus, so the endometrium or endometrial lining, that those glands and that tissue that's supposed to be only in there, it starts to migrate and grow where it's not supposed to in that muscular layer of your uterus. Because that tissue that has migrated is hormonally active, it's going to respond to your cyclical hormonal changes every month, just like the inside of your uterus does. Except now that tissue is within the muscular layer. It's trapped inside the muscle in a manner of speaking, which can lead to symptoms, but not always, as I mentioned earlier. So what ends up happening is that there's a higher surface area of tissue, as well as smooth muscle overgrowth around this tissue inside the muscular layer. There is abnormal uterine contractions. There are more blood vessels that have been generated, and there's also more inflammatory compounds being produced. Inflammation and the inflammatory process is part and parcel of normal menstruation. But what ends up happening in adenomyosis is that tissue in the muscular layer now is contributing to that in a more pronounced way. So we're having more inflammatory compounds, for example, prostaglandins, that can contribute to how someone might be feeling. When your doctor palpates your uterus, because of all these changes, it can actually feel boggy. That's actually the term that is used. And it can also feel tender. The most common symptoms associated with adenomyosis are abnormal uterine bleeding and period pain. Sometimes there can be pain with sex and chronic pelvic pain. I want to quickly talk about abnormal uterine bleeding so you know what to look out for. Abnormal uterine bleeding really refers to the amount, duration, frequency, or regularity of blood loss, any or all of those metrics. So periods lasting more than 7 to 9 days, bleeding in between your periods or intermenstrual spotting. That could also include bleeding after penetrative intercourse, passing significant clots on a regular basis. And I'm mainly talking about larger clots. So clots are defined as small, medium, large. Small is dime-sized or smaller. Large is toonie-sized or bigger. Medium is in between. And then heavy menstrual bleeding we define as anything more than 80 milliliters per period. If you have a cup or a disc, you might be able to a little bit more easily identify the volume of blood you're losing. But if you're using absorbent products, it can be a little bit more challenging. And I did do a whole episode on what a normal period, a normal menstrual cycle looks like. So go check that out for more details. In essence, if you are changing an absorbent product more frequently than every 2 hours and it is fully saturated, if you need to double up on products because you're leaking or you're flooding through products, That is heavy bleeding. Something that gets missed here quite often is people who are within normal limits in terms of the volume overall. So let's say you're losing 70 milliliters of blood, but you used to only lose 35 milliliters of blood. So you used to only have half the blood loss, and now you've doubled. So this technically, like, these numbers are within normal limits, but for you, that's a significant change. So this is something that we also want to flag. Heavy or prolonged bleeding can also show up in your iron status. So iron deficiency, low end iron, or anemia. And this can show up obviously on blood work if we're testing, but also lead to symptoms of hair loss, brittle nails, fatigue, poor concentration, mood dysregulation, shortness of breath with little effort. And then heavy periods and period pain both can contribute to significant decreases in quality of life. So we do want to make sure that we are supporting you through that so that you can live your life and do all the things that you want to do. Now, when it comes to the risk factors and who is more prone to adenomyosis, there's a few categories here. So number one, if you've had uterine surgery, C-section, myomectomy or fibroid removal, a D&C. Number two is multiparity, or if you've had multiple pregnancies. Number three, if you've had prolonged or elevated exposure to estrogen. This is often additive over time or cumulative over time. If you started getting your periods earlier and you got exposure to estrogen over a longer period of time, if you have a high BMI, and really with BMI, what we're really talking about is hormonally active fat, which is going to be mostly around your abdominal organs, tamoxifen use, shorter menstrual cycles. None of these things are guaranteeing that you are going to get adenomyosis, but they put you in a higher risk category. You could have adenomyosis without any of those things. In terms of how adenomyosis is typically diagnosed is oftentimes we're investigating your symptoms like heavy bleeding or intermenstrual bleeding or period pain. When we're working up someone for infertility, we're doing a robust job of investigating your reproductive organs. So that's usually where adenomyosis is discovered. You can use transvaginal ultrasound, which is quite accessible. MRI is also a great tool, but it is a little bit more costly, difficult to get. So transvaginal ultrasound is usually how we're finding it. In terms of the severity of adenomyosis, it's graded based on how much of that muscular layer, the myometrium, is affected. 25% and under is mild, 25 to 50% of the muscular layer is moderate, and then severe is anything over 50%. I want to return to that fertility piece for a minute. The fertility data on adenomyosis is a little bit unclear because it is often found with other things that can also contribute to infertility, like endometriosis. Adenomyosis historically was also lumped together with endometriosis from a research perspective. That said, it is associated with higher rates of pregnancy loss, preeclampsia, preterm delivery, and small for gestational age babies in assisted reproductive technology settings. And that's actually where most of our fertility data comes from in general. Pregnancy loss is 2 to 3 times more likely. If you are someone who has diagnosed adenomyosis, for example, or you're suspecting it, a workup really is important, especially from a fertility standpoint, so you can get earlier intervention or earlier care if you need it. Not everyone with adenomyosis is going to have fertility problems, let me just say that. However, because the likelihood is high, we just want to make sure that you are supported well. And then we're also not missing anything else in your health that is going on simultaneously so that, again, you can get the best care possible and make the decisions based on that. Let's switch gears and now talk about management strategies and treatment options. There is no one-size-fits-all solution here. It really needs to be a discussion with your medical team, and this could be multiple discussions over time based on who you are, how old you are, what your values are, what your goals are, as in, is it symptom management? Are you close to menopause? So that we have a little bit more flexibility in what we do, or you're hoping to ride it out maybe. Are you fertility track? Is there something else going on? As in, are we suspecting endometriosis? Do you actually have fibroids that have been diagnosed? If it was found incidentally and you don't really have symptoms, outside of a fertility setting, we likely don't do anything apart from making sure that your overall health is well supported, and then revisit that conversation anytime symptoms are changing or that you want to. And that really really is the main part. Like, you need to make this decision with your medical team. It can also change over time. You can change your mind over time, depending on the situation. And part of it is going to also be based on your risk tolerance. If you're looking at symptom management, which is in most cases what we're looking at, period pain, the things that we normally use, so pain relievers like ibuprofen, over the counter, or even prescription, combined oral contraceptives for period pain, contraception, as well as irregular bleeding. Hormonal IUDs work really well here, and they are considered first-line treatment for adenomyosis because they have actually also been shown to reduce the size of the uterus, and they manage some of the other symptoms. Other progestin therapies, so progesterone-like molecules, can also be used in adenomyosis, similar to endometriosis. And actually, we do borrow from endometriosis data because we don't actually have that much adenomyosis data. There's also surgical intervention that can be done. Adenomyosis lesions can be surgically removed, especially in a case like fertility, where we're suspecting it might be playing a role. And then if, let's say, someone is close to menopause, or if we're not considering fertility, a hysterectomy is on the table, depending on symptom severity and what the patient wants. Oftentimes, we will recommend pelvic floor physiotherapy, especially if there's significant amount of pain, whether that be pain with intercourse, period pain, and or pelvic pain outside of those situations. We always want to focus on the foundations of health because overall it's going to improve our hormonal health, metabolic health, and prevent abdominal or visceral fat gain. So think about exercise, think about nutrition. When it comes to nutrition, we borrow a little bit from endometriosis, and we know that plant-forward diet rich in whole foods, low in saturated fat from red meat, with adequate omega-3s, limiting alcohol intake. If we take a look at some of the other tools, then acupuncture, massage, TENS machines, so those pads that deliver a small electrical current, topical herbs and pain relievers, heat, and even therapy and mental health counseling can all be part of adenomyosis management. When it comes to integrative care, there are lots of options available, and we're primarily, like I mentioned before, drawing from endometriosis data. Now, how effective are these at decreasing uterine size? I cannot say. However, from a symptom management strategy and from an overall health supporting strategy, whether you are fertility track or in perimenopause, we can definitely lay some robust foundations. We want to make sure you're not vitamin D deficient and bring you up to adequacy. Vitamin D deficiency is associated with a lot of menstrual and hormone-based conditions, and adenomyosis, endometriosis, fibroids fall in that category. So we just want to make sure that your levels are looking good. We want to make sure you're not iron deficient. Iron deficiency is just so common, and so many menstruators walk around in a deficient state. It's not only affecting your menstrual blood loss and not only being affected by menstrual blood loss, but also it affects like your day-to-day well-being in terms of fatigue and energy and hair and nails and all of the bits. So we want to make sure that you are iron replete, as in you have adequate iron. When it comes to other supplements as well as herbs, I really encourage you to talk to a healthcare provider. Even though supplements and herbs are natural, when we're using them in a therapeutic way for symptoms, for a condition, we are using them beyond how we would use them for your general well-being, right? So for example, ginger tea can be helpful for period pain or period discomfort, but if someone has debilitating period pain because of adenomyosis or endometriosis, we actually want to use a therapeutic dose. So we want to make sure that you're getting the appropriate amount, and we're also assessing you properly. Going back to what things can be helpful, ginger is one of the herbs that can help with period pain, any nausea associated with periods, as well as heavy bleeding. Omega-3s can sometimes be helpful depending on the situation. This is especially important if you are low in your dietary intake. There are many other herbs like cramp bark, like boswellia, that can be used. Scientific research is lower on those, but in traditional herbal medicine and in Chinese medicine, they're used quite often. So there's lots of treatment options available. Similar to any pharmaceutical, any intervention, we want to understand what the risks are, what the benefits are, what the pros are, what the cons are. How long do you use this for? What are your other options? How can you layer things? Are they safe to do? Does this apply to you in particular as an individual? What are we starting with, right? Like all of these things matter. So talking to a healthcare provider who can guide you like a naturopathic doctor is the best way forward, because even when things are natural, they are not always harmless. Now, before we wrap this episode, I want to leave you with some tips and food for thought as you navigate your own adenomyosis, if you suspect adenomyosis, or if you're simply trying to understand your cycles and bleeding patterns a little bit better. I sound like a broken record when I say this, but please track your symptoms and track your cycles. Use an app, use a calendar, use a notebook. It does not matter where, but please do. Our memories are imperfect and we just have so much on our minds, so much pressures on our time that tracking and having that record is really, really important. And no one else can do that work for you. You have to be the one doing it. It allows you to be specific in your appointments and it allows you to present data in your appointment. How much blood are you losing and how many period products are you using? Your pain levels and your management strategies. How is it affecting your quality of life? All of these things, when you present it in a way that is cohesive, it makes a difference. You can actually say things like, I've been tracking my menstrual cycles for 6 months and I get 10 out of 10 pain on day 1. My cycles used to be 3 days long, but now they are 6 days long. You can be quite specific. If you're wondering if it's adenomyosis and it hasn't been considered, ask the question. Could this be adenomyosis? If, let's say, you are having symptoms that are unmanaged or just mildly managed, ask for a transvaginal ultrasound, ask for a gynecologist referral. If you are fertility tracked with some of these symptoms, talk to your family doctor about getting a referral to a fertility clinic sooner rather than later, just so that you can get comprehensive cycle monitoring done and imaging done. Test your iron and vitamin D and take those if you are deficient after consulting with your health team. If you're being dismissed, getting a second opinion is really helpful. Building a team is also really helpful. That way you can have management strategies and opinions and discussions with different kinds of practitioners. Our understanding of adenomyosis has improved in the last decade, and I know we're going to build upon that and expand on it in the next decade. I want you to remember that you did not cause your adenomyosis and you do deserve care. The aspect of living with period pain, chronic pain, heavy bleeding that is not discussed enough is the massive toll it takes on your quality of life, your energy, the decision making, the going from provider to provider, looking up answers, trying solutions, your time, missed days of school, life, work, and also the financial cost. If you are in a place where you have to pay for healthcare, there's that. But outside of that, even in Canada, where we have a public healthcare system, we'll put aside the fact that in Ontario, we are seeing a push toward privatization by our current Conservative government. But even outside of that, we have the cost of iron to replenish your stores from heavy bleeding. We have period products. Heavy bleeding requires more period products, and this is something that menstruators are paying out of pocket for. So you deserve care, whatever that looks like for you, and that's really the bottom line here. I hope this episode gave you something useful to take to your next appointment, a reframe that helps you in your decision-making process with your medical team, something that you can pass on to someone else who's experiencing symptoms like these. Make sure to subscribe and follow wherever you get your podcasts or at phase2phase.ca.